Sub-Saharan Africa report 57% of the death of children aged under 5 years old. As we know, babies and mothers are immunocompromised persons. So, regarding these statistics and this alarming rate of death, so we decided to investigate maternity wards because they are the most vulnerable. Burkina Faso and Cameroon also faces high rate of mother and child death rate. And since also they represent different climate regions, we think that by investigating Burkina Faso and Cameroon, Cameroon is located in Central Africa, Burkina Faso in West Africa, we will have representative climate regions that will offer us valuable insight into the impact of climate change on the dynamic of these drug-resistant bacteria that are affecting babies and mothers in maternity wards. The innovative method that we will use to predict bacterial dynamics in maternity wards, we will use social data, quantitative and qualitative data. We will use climate data. We will use whole genome sequencing data, which allow us to have information about the plasmid, the antibiotic-resistant genes, the virulence factor, and we will use predictive models. So by combining all these aspects in mathematical modeling, so we will develop a strong, powerful tool that will help us to predict the dynamic of drug-resistant bacteria in maternity wards along different climate regions. Our method goes beyond the traditional one because we will use climate data, we will use social data, we will use microbial data, whole genome sequencing data. We will also use phenotypic data because we will conduct antibiotic susceptibility testing that will allow us to have also a phenotypic resistance of the critical pathogen that we are investigating in the maternity wards. Our study will help to control infection in maternity wards since we will have data on the most prevalent pathogens that we are investigating, their abundance, and the moment they are more prevalent, it will also help to fight against disproportionate antibiotic use. Since knowing their phenotypic resistance, this will allow a proper prescription of antibiotics in maternity wards by the doctors. This project is built on local participation, community participation, hospital participation, also medical personnel participation and governmental participation. This is why we intend to organize public engagement, workshops, just to engage people, public policymakers in the implementation of the outcome of this project, because we intend to bring together all these people toward this common goal of assessing and addressing the issue of climate and health and the spread of IMR in African countries.